Imagine a time when surgery was a terrifying ordeal. No, really, try to imagine it. Before the mid-19th century, undergoing surgery was often a brutal battle against unbearable pain. Patients had to endure procedures while fully conscious, their cries echoing through the surgical chambers. It's a chilling thought, a stark contrast to the sterile and relatively painless procedures we're accustomed to today. The discovery of anesthesia was a pivotal moment in medical history, marking a turning point in how we approach surgery and pain management. Before this revolutionary breakthrough, surgeons were essentially performing operations on wide-awake individuals. The lack of anesthesia meant that speed was the priority, often at the expense of precision and patient well-being. It's hard to fathom the sheer terror that patients must have experienced. The anticipation alone would have been agonizing, knowing that unimaginable pain awaited them. This era of surgery was a far cry from the controlled and sterile environments we associate with modern medicine. Step back in time with me, and let's paint a picture of a typical surgical theater in the 18th century. The scene was far from the pristine operating rooms of today. Imagine a dimly lit room, often crowded and chaotic, with the unmistakable stench of sweat and fear hanging heavy in the air. The patient, awake and terrified, would be restrained on a wooden table, often with the help of several assistants. These weren't trained medical staff, mind you, but anyone who could lend a hand, family members, strongmen, even barbers. Their job was to hold the patient down as they thrashed and screamed in agony. The surgeon, working with remarkable speed, would then make the necessary incisions, often with rudimentary tools that would seem barbaric by today's standards. The procedures were swift, almost frantic, as minimizing the patient's suffering was directly tied to minimizing the time spent under the knife. It was a brutal and bloody affair, a testament to human resilience in the face of unimaginable suffering. While the concept of anesthesia as we know it didn't exist, that doesn't mean there were no attempts to alleviate the excruciating pain of surgery. Doctors and healers of the time resorted to various methods, some more effective than others, to try and dull the senses and offer their patients a semblance of relief. Alcohol was a common anesthetic. Patients were often given large quantities of alcohol before a procedure to induce a drunken stupor, hoping to numb the pain. Opium and other naturally derived substances with sedative properties, like henbane and mandrake, were also employed, though with highly unpredictable results. These methods were a far cry from the reliable and controlled anesthesia we have today. They often provided minimal relief and in some cases even exacerbated the trauma by causing disorientation, vomiting, or other adverse reactions. The quest for a truly effective method of pain management was a long and arduous one. The mid-19th century marked a pivotal moment in the history of medicine with the discovery and subsequent widespread adoption of anesthesia. The ability to render a patient unconscious and insensate to pain revolutionized surgery, transforming it from a terrifying last resort to a viable and increasingly safe medical option. The story of anesthesia is a fascinating one, with multiple pioneers independently stumbling upon its potential. There's Crawford Long, who first used ether for a minor surgical procedure, and Horace Wells, a dentist who experimented with nitrous oxide. However, it was William T.G. Morton's public demonstration of ether anesthesia in 1846 that truly captured the attention of the medical community and the world. The introduction of anesthesia wasn't without its challenges. Early anesthetics like ether were flammable and difficult to administer, and their long-term effects were not yet fully understood. However, the benefits far outweighed the risks, and the use of anesthesia quickly spread, paving the way for modern surgery as we know it.